There is a small pill costing only as much as a cup of coffee, but it is capturing the attention of the entire medical community. According to a major new analysis published in the JSEC journal, this drug has the potential to reduce the risk of heart attack, stroke, or death from cardiovascular disease by up to 12%. It may sound like a medical breakthrough, but what's special is this. It's not a new invention. It is an anti-inflammatory drug that has existed for thousands of years, once used by ancient Egyptian physicians to treat joint pain from inflammation. And now it is being re-examined as a potential solution in the fight against the silent killer cardiovascular disease. However, things are not as simple as they seem. Some new studies have shown conflicting results. Some users have experienced serious side effects. And for older adults, especially those taking multiple medications simultaneously, the risks may outweigh the benefits. That is why we need to understand it thoroughly before making a decision. In this video, I want to take you through the whole picture from the mechanism of this peculiar drug to the latest scientific findings on its efficacy and risks, and even simple ways you can apply today to reduce inflammation and protect your heart without medication. And if you stay until the end of the video, I will share a very simple exercise that has been proven to lower blood pressure naturally, something many people over 60 desperately need. You may have never heard of this drug's name, but it has been around for a very long time, not in a modern laboratory, but in the ancient medical texts of Egypt. The drug is extracted from a flower with a rather poetic name, the autumn crocus. For thousands of years, the Egyptians used this plant to relieve pain from swollen joints. And even today in modern medicine, doctors still prescribe this drug to gout patients because of its ability to reduce inflammation extremely quickly. But it was from here that something surprising happened. Many clinicians began to notice that patients taking this drug for gout had a significantly lower rate of heart attacks than others. Initially, it was just an interesting observation, but then researchers began to ask the question, could this drug, with its powerful anti-inflammatory mechanism, do something to protect the heart? A pioneering study in 2012 examined the data of thousands of patients in New York. Those who had been prescribed colchicine, the name of this drug, had a heart attack rate nearly half that of the group who did not use it. That result was convincing enough to spark a series of larger, more rigorous clinical trials. Colchicine began to be tested on people who had previously had a myocardial infarction heart attack, a stroke, or had clear coronary artery disease. The goal was not to cure the disease, but to reduce the risk of recurrence to prevent another serious event. And the initial results were truly impressive. Some studies showed that just taking 0.5 milliliters of colchicine daily, a very small dose, could significantly help reduce the risk of having another heart attack or stroke. However, is this story really that simple? Because behind those impressive numbers, there are still many things that need to be clarified. And the next part will surprise you because not all studies have reached the same conclusion. Following the promising findings, scientists began conducting larger, more rigorous studies to find a definitive answer: can colchicine truly reduce the risk of death from cardiovascular disease? And if so, what is its actual effectiveness? One of the most important recent analyses compiled data from 15 randomized controlled trials, the type of study considered the gold standard in medicine. In total, there were over 30,000 participants, all of whom had previously suffered from serious cardiovascular conditions, such as myocardial infarction, stroke, or coronary artery blockage. When researchers pooled all the data and analyzed it, they noticed something very significant. Those who took a low regular daily dose of colchicine had a risk of cardiovascular events that was approximately 27% to 35% lower than those who did not. In other words, just one small pill a day could make a big difference in preventing another heart attack or stroke. The rate of deaths from heart disease also decreased markedly in some studies. But perhaps what interested many doctors the most was the profound anti-inflammatory effect this drug delivered. When they measured inflammatory markers in the blood, such as hsCRP or interleukin-6 in people taking colchicine, they saw a distinct decrease in inflammation levels after just a few weeks. And as you know, inflammation is one of the most dangerous hidden culprits in the formation of arterial plaque, the substance that silently clogs our hearts over time. With these impressive results, many doctors have begun to consider adding colchicine to the standard treatment regimen for cardiovascular patients, especially for those whose cholesterol and blood pressure are stable but who still have high levels of inflammation. However, and this is something you really need to pay attention to, not every study has yielded positive results. Some recent trials have shown that colchicine provides no benefit at all. Why is there this discrepancy, and can we trust the numbers we just discussed? The next part will give you a more realistic perspective and a warning that you should not ignore. If the story ended with those impressive numbers, perhaps colchicine would have become the new standard of care for all cardiovascular patients. But in reality, medicine is always more complex than the headlines. The reason is not all studies have confirmed the benefits of this drug. The two largest recent trials involving over 15,000 participants have produced rather controversial conclusions. One study followed more than 7,000 patients after a myocardial infarction, and another study involved more than 8,000 patients who had previously had a stroke. After 3 years of follow-up, the scientists found no significant difference between the group taking colchicine and the group taking a placebo. The rates of stroke, myocardial infarction, or death were nearly identical. This has made quite a few doctors more cautious. Is it possible that colchicine is only effective in certain patient groups? For example, younger individuals or those with high levels of inflammation, but offers no benefit to all. And that's not all. Another major issue is the side effects. Although colchicine is considered a cheap and relatively safe drug, for short-term use in some cases, it causes very unpleasant symptoms. The most common reaction is gastrointestinal distress, nausea, diarrhea, and abdominal pain. One analysis showed that the risk of diarrhea is 2 to 3 times higher compared to non-users. For the elderly, this is no small matter. A severe bout of diarrhea can lead to dehydration, a drop in blood pressure, and even falls due to weakness. And if you are taking other medications, such as statins, blood pressure drugs, or treatments for kidney disease, colchicine can interact and cause harm. Some people have also reported liver problems or greater sensitivity to side effects compared to younger individuals. One viewer wrote this under the original video, "I only took colchicine for 2 weeks for gout and had to stop immediately because my digestive system reacted violently." That is not an isolated case. Therefore, while the benefits exist if you are in your 60s or 70s, and taking several medications daily, adding colchicine cannot be done casually. The question now is inflammation, the very thing this drug targets, truly so important that we need such a strong intervention? Let's delve deeper into that in the next part. When it comes to heart disease, most people think of cholesterol. More specifically, LDL, often called bad cholesterol. And it's true that persistently high LDL levels over time can increase the risk of arterial blockage. But there is another factor less talked about that plays an equally dangerous role: chronic inflammation within the walls of the blood vessels. Imagine the blood vessels in your body as water pipes. When you are young, they are smooth and blood flows easily. But over time, these pipes begin to get scratched on the inside due to high blood pressure. Elevated blood sugar, smoking, stress, and especially prolonged inflammation. This inflammation doesn't cause obvious pain, fever, or redness, but it silently damages the inner lining of the vessel walls. And it is only when this lining is compromised that LDL begins to adhere to it. LDL is not the first to cause harm. It is inflammation that paves the way for LDL to act as an unwanted sealant. Once LDL becomes trapped in the damaged vessel wall, the immune system reacts, worsening the inflammation. This process repeats, forming plaque like limescale building up in a water pipe, which gradually narrows the path for blood flow. More frighteningly, these plaques can rupture at any moment, forming a blood clot that completely blocks the flow, leading to a stroke or heart attack. That is why researchers call inflammation the smoldering fire in the arteries. And if this fire is not controlled, no matter how good your cholesterol-lowering medication is, the risk remains. The important thing is inflammation doesn't show up in a single metric. You can't feel it like a fever or a headache, but you can actively control it with your own daily choices. And the good news is, you don't need to take colchicine to do it. In the next part, I will share with you 5 simple ways you can apply today to quell that fire right from your own kitchen and lifestyle habits. One of the things that makes me feel most hopeful when talking about heart disease is this: we are not helpless. Even with age, even with a history of coronary artery disease or diabetes, there is still so much you can do to lower the level of inflammation in your body without needing to add another pill. The first and most important habit is to lose a modest amount of weight if you are overweight. Just a 5 to 10% reduction in body weight for example, going from 180 to 165 pounds is enough to see a clear drop in blood inflammation levels, especially the CRP marker. This is because fat tissue, particularly belly fat, doesn't just sit there in the body. It acts like a factory producing inflammatory substances 24/7. The second habit is to change the way you eat fats. Not all fats are bad. A small amount of saturated fat from beef or eggs is not a major issue. But if the majority of your fat intake comes from fried foods, industrial vegetable oils, or heavily preserved packaged goods, that is something that needs to change. Instead, choose extra virgin olive oil, ripe avocados, flax seeds, or walnuts. The monounsaturated and omega-3 fats in these foods have powerful anti-inflammatory effects, and numerous studies have clearly demonstrated this benefit. The third habit might surprise many people: get enough sleep. A deep sleep of 7 to 8 hours per night not only helps the body recover, but also reduces levels of cortisol, the stress hormone directly linked to the inflammatory response in blood vessels. A study at Harvard showed that people who sleep less than 6 hours a night have significantly higher CRP levels than those who get enough sleep. The fourth habit is gentle daily movement. You don't need to go to the gym or run a marathon, but just 30 minutes of walking each day, whether it's around the neighborhood, in the supermarket, or simply gardening, can help improve blood flow, reduce inflammatory responses, and help control blood pressure better. And finally, something that many people often overlook: keeping your mind healthy. Loneliness, chronic stress, or feelings of isolation can increase inflammation. People who maintain positive social relationships, even if it's just a few phone calls a week, a coffee with an old friend, or joining a gentle yoga class, have markedly lower levels of inflammation and risk of heart disease. You might not see results immediately, but the wonderful thing is every small action adds up. It doesn't have to be perfect. Just be consistent, be persistent, and you are quelling the smoldering fire in your body and giving your heart a better chance. However, the question that many people still wonder about is, should I with my age? Medical history and current medications consider colchicine. Who should really use it? Who should avoid it? That is what we will get into right now. The question I often receive after every time I share about colchicine is, so should I take it? And to be honest, there is no single right answer for everyone. Colchicine is not a one-size-fits-all treatment. It is not like the low-dose aspirin that was once widely used, nor is it like a vitamin you can supplement without much thought. This is an anti-inflammatory drug with systemic effects, and it is only suitable for specific groups of patients. So who are the ones who might benefit from colchicine? Typically, they are individuals who have previously experienced a heart attack, a stroke, or have been diagnosed with clear coronary artery stenosis. In other words, those at high risk of recurrence. In particular, if you have managed your cholesterol and blood pressure, but tests still show high levels of inflammation in your blood. For instance, an hsCRP level 2.0, then colchicine may be considered by your doctor as part of your treatment regimen. However, if you are living with chronic kidney disease, CKD, have liver problems, or are taking multiple other medications like statins, blood pressure drugs, or anticoagulants, then colchicine is not a safe choice. The risk of drug interactions or experiencing serious side effects is higher, especially when you are over 65 years old. Another point to consider, colchicine does not prevent a first-time heart attack. It is only useful in reducing the risk of recurrence in people with a pre-existing cardiovascular diagnosis. The final choice is always yours, but it must be made in conjunction with thorough advice from your doctor. Because sometimes what is good for one person is not suitable for another. But if you find yourself outside the risk group or are not ready to take medication, there are still natural options with fewer risks, and that is what I will share right now. If the idea of taking colchicine makes you hesitant, or if you fall into the group that should avoid it, don't worry too much. Because in reality, modern science has discovered many natural substances capable of reducing inflammation and supporting cardiovascular health without causing the severe side effects of some prescription drugs. And the great thing is, you can start with simple, accessible options, some of which may already be in your kitchen or medicine cabinet. The first option is omega-3, especially EPA, the fatty acid abundant in salmon, mackerel, and sardines. In large studies like Reduce It High-Dose Omega-3, over 2,000 milliliters of EPA per day has been shown to significantly reduce the risk of myocardial infarction and stroke. Not only does it help lower triglycerides, but omega-3 also has potent anti-inflammatory properties, naturally calming the inflammatory response in the blood vessels. For older adults, especially those who eat little fish daily, omega-3 supplementation can be a wise step. The second option is curcumin, the main active compound in turmeric. Long known in traditional medicine today, curcumin has been clearly shown to reduce inflammatory markers like CRP and IL-6. However, regular turmeric is poorly absorbed, so you need to look for enhanced forms of curcumin, such as nanoformulations or complexes with piperine. An extract from black pepper to ensure effectiveness. And finally, there is nattokinase, an enzyme extracted from the traditional Japanese fermented food natto. Nattokinase has the effect of dissolving fibrin, the substance that causes blood clots, while also improving circulation and reducing blood viscosity. Some small studies suggest that nattokinase may also help lower blood pressure slightly and reduce inflammation. Although more large-scale data is still needed given its long history of use and high safety profile, it is a worthwhile alternative to consider. Of course, no solution is a magic bullet, but these natural options can be used as part of a comprehensive strategy: eating a healthy diet, exercising regularly, getting enough sleep, and managing stress. And if you're wondering where to start sometimes, the answer lies in maintaining a small, consistent daily habit. In the final part, I will summarize all the most important points and share an extremely simple exercise that has been proven to help lower blood pressure naturally. Don't miss it. If you have followed along to this point, I believe you now have a clearer perspective, not just on colchicine, but on the true nature of cardiovascular disease. We have talked about an ancient, inexpensive drug once used to treat gout that may now help reduce the risk of myocardial infarction and stroke. Some studies show very significant efficacy, a reduction of up to 27% or even more. But there are also conflicting results and numerous warnings about side effects in older adults. We have also clarified one thing together. Chronic inflammation, not just cholesterol, is the silent killer within our artery walls, and you have the power to control it. You don't need to wait for a prescription. You don't need to be afraid. Just start with the simple things. Eat smart, sleep enough, move gently, and keep your mind at peace. If you or a loved one is considering taking colchicine, talk thoroughly with a doctor, not just to ask, should I take it, but to work together to find the safest, most sustainable path that is best suited for your own body. And as I promised at the beginning, there is an extremely simple exercise taking only 5 minutes a day that has been proven to help lower blood pressure naturally. If you are interested in how to reduce the pressure on your heart without medication, watch the next video right here.